So I just finished my training session for today, and obviously I'm the only one here, which is nice because nobody bitches about me doing curls in the squat rack. We have this running gag here at iFast that we can pretty much narrow down any question to 5 basic answers. 1, I don't know. 2, it depends. 3, 7, which is just a really good number. It's PNF, and it's a brain thing, which when you think about it, should probably just be another I don't know, but we'll let that slide. And I want to talk a little bit about it, and it depends kind of a thing. And I was doing lowers today, so I had this quick thought about knee position. And I think knee position is going to be it depends kind of an answer. When people say, what is the optimal knee position for this exercise or that exercise? And I would argue that we probably don't even know what the ideal knee position is. I think we know, from a structural standpoint that we want to avoid extremes, certainly, because we don't want to load certain types of structure, like, end-range knee flexion can alter, the posterior horn of the meniscus, the load on that. And, if you go into hard valgus, we can also deal with meniscal issues or ligamentous overloads and things like that. But somewhere in between, we have this massive gray area. And I would argue that gray area is important because when you're coaching someone through an exercise, a lower body exercise specifically, and we're looking at the knee, that you probably don't even know what that knee position is. For instance, if I put somebody in split stance, and on one set they have their legs split front to back a certain amount, and then for the second set that split changes. You've just changed the pelvic position, which means that you've probably altered the position of the acetabulum, the hip socket, which means that you've altered the movement options of that hip, which means that you've probably altered the femur position, which means that you've probably altered the knee position. So the amount of torque through the knee, you have no idea how much torque that you're applying to that knee. And it's that variability, that gray area, that provides us the safety zone. So there's not one optimal. And I would argue that if you are in some certain camp where you think that you should push the knee out or push the knee in, or I don't really care, what your argument is, I would argue that you could potentially be limiting movement options and actually causing a problem for your client by doing so, because now you're going to potentially overload the same structures over and over again, which can cause some wear and tear. Whether that results in a pain experience, who knows? We can talk about pain science at another time, but I think that your goal is to, 1, make sure that your client has sufficient variability in the joints in question, and then you limit how far they will go and keep things pretty. And if you don't like that as a coaching cue, I would argue that you don't have anything to really come back with, because you're not measuring anything, you're eyeballing. And we also know that fatigue changes motor control, which means that the 9th rep on a set of split squats is not going to be the same as the 2nd rep on a set of split squats, because you're accumulating fatigue. Motor control is going to change, and that means joint loads are going to change. And so you're not monitoring that either. So, we are faced with this dilemma that we don't have one ideal, and we have to keep people in this nice sweet spot, this gray area, where we have enough control and yet enough instability to allow people to adapt as things change, as fatigue changes, as the surface of the ground changes, as the load changes. All of these things are going to influence the movement outcome, because context always matters. So if you ask me, what's the ideal knee position for such and such an exercise, I would just say it depends.